Shortages of contraceptives at public health facilities are putting women's health at risk. According to new research by the Stop Stockouts project, birth control medications made up 40% of all medicine stockouts reported between April and June this year. Health activists have warned that the impact of contraceptive stockouts fall exclusively and negatively on women and girls and risk unplanned pregnancies and abortions. For more on this, let's bring in Section 27 legal researcher Bauna Twala. Thank you so much for speaking to us this evening. Now, given the percentages identified by your survey, how many people are likely to have been affected by stockouts of contraceptives between April and June this year alone?
So we surveyed about 15,000 people, and that would be 7% of 15,000, which would be just under 1,500 people of the people surveyed. Yeah, and that's just the people that responded, and it doesn't necessarily include a more generalized picture.
So how widely were these stockouts of contraceptives experienced across the whole country?
Sure. We collected data in 7 provinces from around 405 facilities, and that's a really broad and representative picture of facilities around the country. And so we can say that it was very widely experienced, except for the Western Cape, which we weren't able to report on, and then the Northern Cape, where there were a very small number of facilities that we were able to survey.
So why do contraceptives have such high levels of stockouts?
We're not really clear on the why. That's something that we would really like government to provide an answer to. What we've seen is that there's been an improvement in stockouts overall, but that now the issue seems to be with contraceptive stockouts, and we're hoping that government can address that in the way that they've addressed other stockouts that had been an issue in the past.
So we also know that it's not just contraceptives. The research also showed that 16% of facilities were out of stock of HIV medication and 10% had no pregnancy tests. So talk to us about the feared impact of these stockouts, of these very critical drugs.
Yeah, I think the impact is really felt by women and girls who are vulnerable members of our society. And so what we see is that if women can't get access to contraceptives, then they are unable to manage or plan, things like family planning or children that they want, or even be able to prevent pregnancy. But also contraceptives are used for treatment of certain reproductive issues. And so then what we see is a lot of unwanted and unplanned pregnancies, which will likely then lead people again to seek abortion services, which government fails to provide, and so which will likely then lead people to seek out unsafe and illegal abortions, which has negative health impacts on women and girls, as well as if they are unable to access abortions, or if they don't necessarily choose to have abortions, but they feel that they've been placed in this position where they had an unplanned pregnancy. Then they will have their certain socioeconomic impacts of unplanned children, most importantly, the financial burden, which will also then have to get support from government, which increases the cost on the state. And so really there are roll-on implications for women, as well as socioeconomic impacts on the state, as well as on general public health and budgeting in terms of social welfare.
As well as I can only imagine the mental health effect of being completely disempowered, and that the choices that you would autonomously make for your own body have been denied you due to the unavailability of medication. So I want to get to this. The government says that Section 21 alternatives have been sourced in many of these instances. Is this a practical solution?
Our understanding is that it's not necessarily a practical solution. Some of the facilities that were surveyed, staff reported that they hadn't necessarily been instructed on. Some of the staff reported that they had not been instructed on how to advise patients on alternatives and how to be able to kind of make the decisions about what alternatives should be provided. And so there isn't a universal policy on how alternatives should be provided. And so it can differ from clinic to clinic. And alternatives may not necessarily work for the woman to whom the alternative is provided. We're not really sure what that alternative might be, but depending on the alternative, it might have implications either for her health or in terms of the ability for her to successfully use the contraception.
Is there currently still a shortage of contraceptives?
The data we have is the data that was collected up until June. Richiza will continue to monitor contraceptive stockouts. They'll be doing that again throughout the different quarters throughout the year, and we'll be able to monitor the situation on what is happening with stockouts around the country.
Just talk to us about your level of engagement with government in terms of trying to get those answers as to why contraceptives specifically are not being provided for consistently and in a stable environment where women have the kind of health care that they deserve.
Sure. So we shared the report with provincial departments of health. And as you know, we launched the report today and we invited the National Department of Health. On both occasions, we did not receive an adequate response or one that addressed the issues. And then today we were unable to get a representative from government to be able to answer those questions. And so we're as stumped as you are. And if you get hold of those answers, we'll be interested to hear what they are.
Well, we definitely will continue. We will try and follow up from our side as well to see if we can get hold of someone to answer that very important question. Thank you so much for speaking to us. That was Section 27 legal researcher Baone Twala.